Welcome everybody. Thank you for joining this. And if I think I see everybody's names across the top. I don't know if all the participants can see them, but Mr. George, how many people do we have on so far?
We're up to 42 participants.
That's impressive, guys. So thanks, and thanks to all the technologists in the world who make things like this possible. Zach Malloy, could you lead us, please, in just an overview of the meeting and the Pledge of Allegiance and the Scout Law? Mr. George, if you could advance the slides.
Okay.
Where are we going here? So here.
Get rid of that echo.
I think that's actually Zach echoing.
Okay.
Okay.
All right, Zach, we're going to mute you because it's a funky echo. So let's just go to the flag, please. And if everybody could just do a salute or put your hand over your heart and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, God, indivisible, liberty, and two. All right, next slide, please. So guys, let's recite the Scout Law. Scout is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent. Too. Thank you. Next slide, please. So guys, tonight we're gonna talk a little bit about coronavirus, and then we're gonna go into the public health merit badge. But I just kind of want to explain to you my feelings on this, because to me it has everything to do with be prepared. So you all know that this is our Scout motto. And Baden-Powell did this, and he said that this means that you're always in a state of readiness in mind and body to do your duty. And we're 112 years later, preparedness is still just a really important part, a cornerstone of scouting. I think right now is an incredible opportunity for scouts to put the Scout motto into practice. And tonight's meeting should help us do this. Next slide, please. So before we start on this, let me just a couple of ground rules here. So there is a chat window. If you have some questions, Mr. George, is that the little bubble at the bottom?
Yeah, the little bubble at the bottom. And if you want to make sure that change it from everyone to myself, and I will be able to proxy the questions.
Okay. So I can see all these questions as well. I believe everybody can.
All right, then let's leave it as everyone.
Yep. And we'll try and address them as we go. And we have parts of the presentation where we have a built-in pause for questions. And then we can go over some of the mechanics. I see that Jordan's asked about the packet. We'll talk about that in the end, but you don't need a packet right now, right? So we're not even into the merit badge yet, although everything we're going to talk about at coronavirus has a whole lot to do with public health and public health merit badge. And then just one other thing. So one of the things we're trying to do here is just really educate you and convince you that it's important for you to be educated. There's a whole lot of possible rumor going around, and there's people, not really looking at reliable sources of information. And, I'm not a health guy or an epidemiologist, but I know where to go to find that information. We've also got Mr. Sensilla coming on later on, and he's a very senior doctor of emergency medicine. And there's really good websites where you can get, the real story, and not just stuff that's floating around social media. So I want you guys to just think about that and be super responsible, and we'll talk about that a little bit. So you've probably seen a whole lot of this. I'll try and go through it quickly. Coronavirus is a brand new disease. It showed up in 2019. That's why it's called COVID-19. And it's a respiratory illness. It can spread from person to person. And it was first identified in China. And people that have this can get anywhere from a mild to a very severe respiratory illness. It almost always has a fever and a cough. They say it's a dry cough, and it has shortness of breath because it really, really affects your lungs' ability to breathe. Older adults and people with underlying medical conditions like heart or lung disease or diabetes, they're at much higher risk of having more serious complications. They can get pneumonia in both their lungs, and that can just translate into organ failure and death. Next slide, please. And that's kind of what it looks like. And that's really interesting because when we go into public health merit badge, you're going to see a similarity between this and the influenza virus. And these little florets on the top, they're called little coronas. That's actually a really cool way, a susceptibility or an Achilles heel, if you want, of the virus, because it's very easily broken down by soap. That's even better than alcohol wipes. And we'll talk about that in a minute. And oh, by the way, almost all of this stuff that I'm showing you comes from the CDC, Center for Disease Control and Prevention. And you can find almost all of this stuff at cdc.gov. Next slide, please. All right, how does it spread? So they think it probably started from an animal source, but it's now absolutely spreading from person to person. It's mainly thought to be spread when people are in close contact with one another, about 3 feet. And through these droplets that are produced when you cough or sneeze. It's also possible that you can get this by touching a surface or an object that has a virus on it, and then transferring that touch to yourself, like touching your mouth or nose or your eyes. But it's not thought to be the main way. So it's the principal way is through, basically getting those the aerosolized droplets when people breathe or cough or sneeze on you. Next slide. So how do you prevent this? The best way, well, the only way to prevent it right now is to avoid exposure. So there's no vaccine. The best way to prevent the illness is just avoid being exposed to it. And again, it's spread by people in close contact and through the respiratory droplets. Next slide. Sorry, guys, there's going to be a little bit of repetition here. Okay, so how do you protect yourself? You've heard this again and again, I hope. Clean your hands often. Wash your hands often with soap and water. I don't know what often means, but I'm probably doing 20 times a day, maybe more. Some of you guys know we've been in a self-quarantine in my house because my daughter was sent back from northern Italy about 10 days ago. And she has no symptoms, but in order to just be safe, we assume that she could be carrying the virus. And we've sort of isolated her in a room and in most of the house, and we're just cleaning here all the time. So soap and water is actually the best treatment for this. It's much more effective than using a hand sanitizer. So it's funny, I was in CVS the other day and this guy was like really distraught because they had run out of hand sanitizer. I'm like, sir, you should just use soap and water. I said, it's actually more effective because it breaks down the little coronas better. It's called a surfactant, and it literally breaks apart the bonds of the virus and kills it. And he looked at me like I was from Mars. He's like, are you sure of that? And I said, yes, sir, I'm sure. And you can go to cdc.gov and educate yourself on this. I mean, I wasn't mean to him, but so soap and water is really best. But if soap and water aren't available, then you can use the hand sanitizer. And you've heard that it has to be 60% alcohol. And make sure you check because some of them actually don't have that. And then obviously avoid touching your eyes, nose, and mouth with unwashed hands or really at all. Next is avoid close contact with people who are sick, obviously, but also putting distance between yourself and other people if COVID-19 is spreading in your community. So I think you guys all know that COVID-19 is spreading in our community, and that's why a lot of you guys are out of school. Next slide, please. All right, so our troop safety officer, John Conahan, conveniently found this. Mr. George, can you unmute John, please?
Oh, I'm muted. Can you hear me? Sorry.
Yep. Thank you, John.
You want to tell us about this great video you found and show it?
Okay, so this is pretty much how you should be washing your hands every single time you do so. A lot of people usually just quickly rinse their hands and put a little bit of soap on it, which is helpful, but this is how you make sure there's nothing on your hand or your arm after you've done so.
And Mr. George, if you could start this, let's see if this works on WebEx. Sound? I don't hear the sound coming through.
Yeah, it's here, but it's not coming through.
Okay. Well, we'll send the link around, but they're speaking about this in actually a very nice, it sounds like a British accent, I think, right, John?
I, I believe so. It's mainly music that's over it.
Okay.
And especially the one thing you want to pay attention to at the end here is actually, especially in public restrooms, is taking the paper towel that you dried yourself off with and using that on the knob because that's probably already contaminated with whatever you had on your hands before.
Okay. Let's please click this one more time, and just seriously watch this, right? Because what they're doing is, in addition to getting their palms, right, they're making sure to get the thumbs, the tips of each finger, the backs, palm to palm. That's what everybody kind of does, but front to back and interlocking in between the fingers, right? Palm to palm again with the interlock, rubbing both sides with a clasp. That gets the tips of your fingers, cleaning each individual thumb. There's the tips again. And then your wrists. And then a really good rinse. Dry first, the water's still running, that's okay, and then turn off the water last. So we'll send the link around after the fact. I'm sure you've seen this and known it, but take time to do this, right? Otherwise, you're kind of wasting your time. If you're going to wash your hands, wash them well. And again, this is much, much, much more effective than using sanitizer. So if you ever have the choice between soap and water or sanitizer, always go for the soap and water.
And if I may add, this will take 20 to 30 seconds. You want to make sure so you can make sure that you clean them properly. That's the main point.
And there's some really good song suggestions for this. So, like "Staying Alive" or "Happy Birthday." All right, Mr. George, next slide, please. Okay, so those steps were protecting yourself. Here's how to protect others, right? Obviously, stay home if you're sick. And we're going to talk about what to do if you feel sick in a couple of minutes. Cover your coughs and sneezes. Use a tissue or the inside of your elbow. And throw used tissues in the trash. Immediately wash your hands. Again, the way we just showed you if you do sneeze, because that's the carrier, right? And a sneeze actually goes really, really far. So blocking it is really, really important. And just blocking it with your hands, it just sort of blows out from all your hands. I guess that's better than nothing, but you want to sneeze into something. If you're really, really sneezy, make sure you're carrying around something to sneeze into, like a bandana or a handkerchief or a dish towel or something. Wearing a face mask if you are sick, and then cleaning and disinfecting. This is what I told you guys we're doing around our house all the time. Tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards. Take the cover off your phone because the microbes and the virus can get inside in between the case and the phone. Wipe it all down and wipe it down really well with a wipe. If your phone is actually water resistant, use soap and water and scrub it. So if there's just dirt, you clean it first and then you use detergent and soap and water for disinfecting. Here's the other thing. If you're going to spray like Clorox solution or something, a lot of people just spray and wipe it off. And that's helpful, but it doesn't really disinfect unless it sits on there for like 3 to 5 minutes. So you got to spray it on and leave it wet. If you really, really want to disinfect something, you have to leave the liquid on there and let it act and kill whatever it is it's trying to get rid of before you wipe it off. And there's a lot of information about this also at cdc.gov. Next slide, please. Okay, so coronavirus has spread very quickly, and you may or may not have seen information about this. Why has it spread so quickly? Well, it's new, and people haven't been looking for it. So coincidentally, the symptoms are very much like the flu. So we got lucky that people were studying the flu, and they saw people that came in with flu-like symptoms, and they said, is this the flu? And then they looked at it and they said, it's not, it's something new. But they hadn't been specifically looking for this. Initially, there were delays in reporting about it, whether that was accidental or intentional. There were definitely delays. And the virus itself is actually, it's a tough little bugger. It spreads very effectively. Here's the final piece, right? The world is very interconnected, and people can get from A to B much, much faster than they ever did before. Pages, quick, and you can get lots of other places. Can someone mute, please?
Okay. Got it.
That might have been me. No, you got it. Thank you.
Yep.
So you know, the fact that this is going to spread and it's spreading the way it is not a surprise when you can fly from here to Europe in under 6 hours, and then all of a sudden you're spending a whole lot of time and getting on a train and going lots of places. If the world was a little bit slower, this would have spread slower, and it would have slowed down the demand on the healthcare system and the curve that we're about to talk about. Some countries were actually very effective in stopping the spread because they did the kind of things that we're doing in the US right now. They did it very early and very forcefully. So China itself, even though they got a little bit of a late start, they were able to lock this down in Wuhan province very, very quickly. But the better examples are Hong Kong and Singapore. And even though they had initial people coming in, they immediately started testing and stopping large meetings and gatherings. And it's the amount of exposure and spread and illness in those countries has been much, much lower than a lot of other countries. We're going to see that in a minute. Mr. George, are there any questions we should address yet or not?
Not that I'm seeing.
Okay. All right. Next slide, please. Okay. So this is super interesting. And this is a time-lapse history of where all the coronavirus incidents occurred, both infections and then deaths. They're counted at the bottom. And it goes all the way from, well, we'll see it, but in the top right, you'll see a date and time, and you'll see the countries grow in their intensity. You might be surprised that the USA actually had cases before Italy, but then Italy got really, really bad at the end because everybody's hearing about Italy and Iran right now and South Korea. But Mr. George, let this thing run. It's about, I think, 3 minutes. So here we go, January 20th. It's all in China. And down at the bottom, all right, look at that. USA was very early, right? Because we have a tremendous amount of business and contact with China. And you see China's neighbors, Thailand and Japan, Hong Kong, Taiwan. Here goes Australia, France. And we're what, a week in, Canada. And the intensity, the darker the color, the greater the number of incidents there. Here comes Germany and Finland. It was very interesting. The source of the virus in Italy actually was Germany, the original source. They traced it. And now we're into February. Here comes Russia. USA is getting a little darker. It was interesting that Africa and South America were spared early on. And I think there's still no cases in Greenland. Maybe that's where we can all go. At the far bottom, you'll see the number of people recovered in green. So there is recovery, right? And you've probably heard that, not everybody gets really sick. In fact, young people seem to be resisting this incredibly well. But that doesn't help the non-young people around you. And that's why you're all being quarantined. Spain, we're halfway into February. Again, this thing started in 2019, but it didn't really start taking off. I see a couple new questions there. We'll get to those shortly. Adam Kiewski, the coronavirus is not the common cold. It's much, much, much more serious than just a common cold. It can have significantly stronger effects, especially in people that are weak. So that's why people are very, very concerned about this. It's a much tougher bug. You shouldn't call it a bug because it's a virus. We're about 3/4 of the way through this. Now China's over 50,000 cases. USA is ramping up. And here comes almost all of Europe. James will address what we're doing in the future soon, but we're probably not going camping. Countries infected but do not appear on the map. Who knows those flags? Poland, I guess? No. Romania? Thank you, John. And is that it, Mr. George?
Yep.
Yeah. Okay. So that just showed you guys. I mean, that's just a really just move back. That's fine. It just happened really, really quickly because that's not months. That was a few weeks, right? To go from just isolated in one region in a few weeks. And this is a really, yeah, that's just really, really fast. So it's a tough little bugger, and people are spreading it very, very rapidly. Again, it's explaining kind of why the situation that you and we are all in right now. Mr. George, next one, please. Okay, so this is a really cool graph that's going to show a changing bar graph. If you could click on the link, Mr. George. Go back.
The link.
Yeah, that one. And then scroll down, please. Maybe 2/3 of the way down is that one. Right. So this is starting on the left, and you see that originally these are cases outside of China. So South Korea had the most cases, and you might have heard a story that they had a church where lots and lots of people gathered, and they were able to they spread this thing very effectively. But here comes Italy and Iran very close by, and very rapidly overwhelmed South Korea. And Italy is well over 10, 12,000 cases now. Yeah, and then originally the Diamond Princess cruise ship had the highest concentration of cases, but at the end that just gets blown away. So again, just another example of the speed of this, and you know how rapidly it's spreading around. Okay, next slide, please. Okay, so this is sort of the key of what I wanted to talk about tonight, right? And have you guys make sure you understand this. I think this is the most important graph, and we'll zoom in on it in the next slide. But this is what we're trying to do. We're trying to reduce the spread as much as possible, right? It is going to spread, but we're trying to slow it down and just reduce the number of people that this is going to get to. That in turn reduces the burden on the healthcare system, right? Because if all of these people get sick all of a sudden, they're all going to need attention, and there's just not enough resources to do that. And that means doctors have to make really tough decisions between who to treat. And that's what's going on in Italy right now. There's some very, very sad stories of there's just simply not enough breathing machines. There's just not enough people to even like look at these patients that are coming in. They're completely overwhelmed. And Italy hasn't reached its peak of cases yet. They're not expecting that for another week or two, they think. So by slowing this thing down, it gives us more time to increase testing. And increasing testing allows us to isolate where are the little locations, like that South Korean church or like the cruise ship, where it's propagating really quickly, and then we can go after that and isolate it there. Increasing preparedness by just having more tests and more ventilators ready and more masks and more hand sanitizer and everything else. People are studying this like really, really fast now. Like science has gotten so advanced that we're able to learn about this thing much faster than in years before. All of that helps us improve the odds of fighting it and ultimately finding a vaccine. So I've actually invited Mr. Sensilla on tonight. Nick and Connor's dad is Dr. Bob Sensilla. He's the chief of the emergency department at the Einstein Medical Center over in East Norriton, or I'm not sure if it's Norristown there, Bob. But I've asked him to talk to you guys a little bit about what they're seeing and doing at the hospital and how they're preparing. Tim, could you make sure you've unmuted Nick?
I did.
Bob, are you with us?
Yeah, I'm here. Can you hear me okay?
Perfect.
Okay. And Connor's back, Bob. So Connor's actually here with us as well.
Great.
All right. So he's sitting with me. So good evening, guys. Glad that I could participate and hopefully be a resource for you and maybe answer some questions towards the end if you have any. So I'll give you a little update of what the last weeks in my world has been. And it's constantly evolving, a lot of moving parts, a very fluid situation because information is coming at us fast and furiously, and it's kind of hard to keep up with sometimes because you want to make sure that your staff knows what they should be doing and when they should be doing it, and the best ways to protect our patients and our staff members and their families. So there's been a lot to kind of have to take in over the last few days. We haven't seen anybody test positive yet at Einstein Montgomery. And part of the reason is that we are still having difficulty actually trying to get patients tested because the county health department is very overwhelmed. The state lab that runs the test for COVID-19 is limiting the number of tests that they can take. And we just in the last 24 hours are now able to send tests out to third-party companies. So you might have heard of a company called Quest Diagnostics. There's also a company called LabCorp. And those companies have worked very quickly in the private sector with the federal government in order to create a test where we can send samples from patients to them. But it's still taking us 3 to 4 days to get positive and or negative test results. So we still have to wait for nearly half a week to get a result back on a patient. So we certainly may have been seeing patients with this disease as if they do have it, but we can't confirm or deny whether or not they're actually positive for it. So it creates a challenge because this time of the year we still see flu patients and we still see patients with a virus called RSV. But some of these presentations, when the patients come in and they look like they may have the flu and their flu test is negative, we have to assume that they could have the coronavirus. We have a very busy emergency department. Some of you may have visited us at some point there. So not only are we trying to take care of patients and all of the other general emergencies that we would see, but then we have to manage the patients that might be presenting sick with an illness like this on top of it. So it's always a balancing act. We are doing things that are sort of outside of the box thinking. One of the things that we're talking about doing is actually taking a section of our parking lot and putting up a tent that you can actually drive motor vehicles through and creating a drive-through testing station that may happen over the next few weeks, depending on how many cases we're seeing and how busy we are, where the patients actually don't have to actually leave their vehicles. We can kind of eyeball them from the window. That way we have our personal protective equipment on. We call it PPE. And it limits our contact with those patients. It also limits the contact that those potential patients have with other people that might be in the emergency department itself. Because if we don't have to have people come in that aren't sick enough to be in the hospital, we don't want them there because that helps to limit spread, like Mr. Trejo is talking about. So the more we can do to limit exposure to other folks, especially those that already have immune systems that might be compromised or those that might be older and have other chronic medical conditions like emphysema, or they might be a dialysis patient, or they may have cancer. The more we can do to limit contact, the better off everybody is. So I can leave it at that. And Bob, if you want to, if you have specifics that you'd like me to kind of talk about otherwise, or people have questions, I'm happy to answer those.
Yeah, let's so guys, we're going to advance to the next slide because I want to zoom in on this graphic, and then if you have any specific questions for Dr. Sensilla, put them in the chat window right now. And there's one there, Bob. Take a look at that. So while I describe the slide, so this is just a different. It's the same slide as we saw before, okay? And this is what's going on right now. So across the bottom on the x-axis is the time since the first case, right? So we already know that we've had multiple cases in Montgomery County, and there have been a bunch of cases in the US. So we're already beyond the left bottom corner of this curve, right? So if the cases start multiplying really, really quickly, like they did on the cruise ship, because all those people were jammed in together, or they did in the South Korean church, or they did in places where they didn't try and prevent it, in some of the countries that we just saw a couple of minutes ago, right? Like Iran and Italy. What'll happen is the virus will spread so rapidly that you'll have this. Tim, can I annotate? Can you just shine a light on the steep part of the curve?
Up in here?
Yeah. So that would be the number of cases on the left, right? So you'd be having a really, really steep acceleration in the number of cases over a short amount of time. That's called, they call that uncontrolled transmission. And this white dotted line across the bottom, right? This is just a random line in here, but we're calling that the healthcare system's capacity, right? So that's the total number of hospitals and doctors and emergency rooms and guys like Dr. Sensilla, right? There's not an infinite number of them, right? If 10 people get sick, Dr. Sensilla can take care of it. If 100 people get sick, he's going to be struggling. But if 1,000 people get sick, he's got a problem, right? So what we're trying to do is limit the spread of this thing so that Dr. Sensilla and everybody else in the medical profession can handle it in a stable and a controlled way. And that represents the other curve right here, the curve with the blue line on it. It means we've slowed down the level of transmission, and we've done that. On this graph, they're calling it through proactive measures. And if you look at that asterisk at the bottom, proactive measures are social distancing, such as teleworking, limiting large gatherings, reducing travel, or more assertive approaches. Guess what? This is why you guys are all out of school, okay? Because putting you in school is going to increase the ability for you to spread this to each other. We have no idea whether you have it or not because we don't have enough testing in place yet to really have a good idea of where this exists and it doesn't. If we had really, really good tests and we could get everybody tested and you guys were all clear, we could send you back to school, but we're not there yet. That's what we're in the middle of, right? This thing came out really fast. We weren't prepared for it. And we're trying to do our best to not be in that steep mountain at the front, but in that nice little hill at the end. We know this is going to spread around. We're just trying to delay it and delay it in a way that doesn't overwhelm the healthcare system's capacity to deal with it. So you might have seen this as a hashtag. This is called flattening the curve. Flatten the curve. And for those of you guys taking pre-calculus or calculus, if you actually look at these two, the area under the curve on the right is smaller than the area under the curve on the left. By doing this, you actually have fewer cases. And if you have fewer cases, you have fewer severe illnesses and you have fewer deaths. And ultimately, that's what the healthcare system is trying to do. So let me stop there. And what do we have, Mr. Sensilla? Do we have anything here, Doc? Can you see these? Tim, he might be muted.
He's unmuted now.
Okay. Sir, are there any similarities with COVID-19 and the common cold? If so, what are they?
So there are some similarities, but the severity of COVID-19 is worse in individuals who are older. When you have a common cold, typically you start with a little bit of a scratchy throat and a runny nose and maybe a cough, a dry cough, which is similar to the early presentation of COVID-19. However, the length of duration of COVID is closer to 2 weeks. A common cold usually lasts somewhere between 7 and 10 days. And what we're seeing in patients around the world is that younger people, especially those under the age of 18 years old, may remain almost completely asymptomatic, if not with the most mild symptoms, and just may carry the virus and become immune to it, as opposed to those who are healthier middle-aged adults who get kind of a cold like I sound like I have right now. And then those people who are over the age of 60 who have what we refer to as comorbidities, meaning that they have chronic other medical conditions that put them at higher risk, like diabetes or high blood pressure. And those are the folks that we're most concerned about. And those are the folks that have the highest percentage of mortality, meaning that they die from this most frequently.
Okay, thank you, Doc. There's another one here, and I think this is a really important question because people are going to want to do it, right? Like we live in Montgomery County, and a lot of our families, don't want for much. And here's somebody that said, how much would an average COVID-19 test cost? How would we get it? And how difficult is it to get it? Is it worth getting tested if we are in quarantine and at low risk?
So I'm going to answer that question backwards. Right. So I would say if you're healthy and you're relatively asymptomatic, whether or not you're tested at this point probably isn't going to change things because the course of the illness will run. You're going to get better. you treat yourself symptomatically, and you do what you can to prevent the spread, like most of this discussion has been about, so that you're not putting other people at risk. It's still fairly difficult to get tested in Montgomery County. I think that over the next 48 to 72 hours, we're going to see that that's going to loosen up a little bit. And over the next few weeks, we're going to find that testing is going to become more readily available. There was a press conference on tonight about all of the private institutions that are working with the federal government to make sure that testing is much more readily available, and that institutions like CVS and Walmart and Walgreens are all actually going to offer space in their stores and or parking lots where people will be able to go onto Google and find out where there's drive-up testing available, and you can take yourself with your families if you're so inclined, and you want to get tested. That process is not in place yet, but that looks like something we're heading towards. Tests are a couple $100 a piece. Obviously, if you have health insurance, it's going to be covered by health insurance. I'm not sure what the charge for an out-of-pocket cost for a test would be. There's the possibility that exists that they may be covered and free, just so that we can do what we can to kind of mitigate the spread of the virus.
Thank you, Doc. Let's see. Effects of the virus in the Middle East. Aviv, we don't have really good information on that, so I would send you to like Aviv is asking about the situation in Iran and in the Middle East. I would send you to the CDC. The UK Health Service is particularly good. They take a much more global view. I don't know if there are cases in Israel, but I would imagine there are. Israel has been very aggressive about closing.
There are 102 or 43 cases of sick people, and they're like, I think like more than 100,000 at their homes, locked in their rooms. So that's in Israel.
Okay, and you've been sent home, right? So you've been sent home from your school to isolate for what, a week or 2 weeks?
For until 16, so it's a month.
Right. There you go.
Yeah.
All right, so it's not just us, and it's not just Montgomery County. There's a whole bunch of questions here about the source of the virus, and not exactly sure. And I'm just going to let me hold off of those. If the symptoms don't show immediately, is staying out of human gatherings the best that can be done to avoid spreading the virus unintentionally?
Yes.
Yeah, that's part of social distancing. Doc, do you want to address that?
Yeah, I mean, if you've come in contact with somebody who is suspected of having the illness, or you've traveled from an area where the illness is now endemic, or you have had contact with someone who's been in contact with someone who has it and you have symptoms, then yeah, self-quarantining is probably the best thing to do.
And I told you guys, so, let's see, I think either Parker or Spencer asked this. Our sister was exposed to someone, she is quarantined. Why didn't they test her if she could be a carrier? Again, guys, if there were tons and tons of tests available and you could just drive over to the CVS and get a test, that would make a lot of sense. But there's very, very few tests available right now, right? And we want to save those for the people that are actually sick, not people that might be sick.
And the other thing is, if you test too early, you'll have a negative test and you could still end up with a disease days later.
Thank you, Doc. That's right. That could be a false negative. So you really need to present with symptoms first, right? But in case you are carrying it, the best thing to do is just to not increase the chances of exposing somebody in case you are. And like I told you guys, my daughter came back from Italy 2 Mondays ago. That's why I wasn't at last Friday's meeting. And we're just assuming that she could be carrying this. And we're taking her temperature 3 times a day, and our own. We have little red tape on the counter. I was actually going to show you guys tonight, but it's upstairs. Like, she has her section of the counter. She has 2 shelves in the fridge that are hers and a shelf on the door. And she doesn't touch anything else. And we don't touch any of her stuff. And we're cleaning up all the time on the chance that she's a carrier. Why is there a toilet paper crisis right now? That's a great question, but that's sort of overreaction. It could be a seasonal. So Luke says, I read something that COVID-19 may become a seasonal recurring disease like the cold or the flu. Is there any credence to this idea, Doc?
There is. So what we want to do is get as much of a handle on it as we possibly can, so that there's as least transmission this time of the year, you know, in this first quote unquote outbreak that we're seeing, because it can kind of stake a claim like the flu does and or RSV does every season. And that's the goal of also working on creating a vaccine for it, so that if we start to see cases again, you know, into the next year, we're likely going to end up with this as part of our vaccination regimen that we have to go through every year.
That's right. So we probably end up with a COVID-19 vaccine. Hopefully the sooner the better, right, Doc?
Yeah. I mean, you know, just for a little context, for how rapidly science has advanced and how fast people from the public health sector and the CDC and the National Institutes of Health. There's a really interesting physician, if you want to read about him online, Tony Fauci, who is a really brilliant man who's been really actively involved in this. And he's working with another physician who is really engaged with HIV in the 1980s. It took years to develop a test just to test for the HIV virus. And they developed a test in weeks for COVID-19. So that's how much things have advanced. So we're looking at, in theory, a vaccination maybe within 6 to 8 months if all things go well, when typically that would have taken years in the past.
So that's really good news. All right, just mindful of time. And I see a lot of questions about panic buying and stuff like that. We're gonna skip that and try and stick to the science of the disease right now. And we'll try and answer those perhaps after the presentation. Mr. George, could you advance, please? All right, so I'd like everyone to stay off the chat for a minute, and I want to talk about what you guys can do right now, right? So the Scout motto is be prepared, and I want you to think about these things, and it's sort of the whole reason we were trying to educate you tonight and bring in Dr. Sensilla and tell you what you can do to just be really smart about this. So the first thing is take care of yourself. And I wrote down the things that I thought kind of correlated to that with the Scout Oath and Law. So physically strong, clean, obedient, trustworthy. So follow the rules. Follow the rules on hygiene and cleaning your hands and sneezing and keeping distance. Don't shake hands with people. Don't share, cups or straws or anything like that. If you haven't gotten a flu shot, go get a flu shot and ask people in your family if they've gotten their flu shot, right? Because the last thing you want to do is get the flu right now and show up at the doctor's office or the hospital and they're not sure if you have the flu or if you have coronavirus. If you need to take medications for anything, right? Usually adults are taking stuff for high blood pressure, but some Scouts are taking medications for other stuff. Take your medications, right? And keep yourself healthy. Sleep well. Get exercise. You're not going to gym at school, but that doesn't keep you from going outside. Or if you have any gym equipment at home.
Ian, right there.
Could you guys mute, please? Spend time on that. Hey, and especially if you're going to Philmont, like we're probably going to have to put off our first prep trip. So you want to start getting in shape for that and following a healthy diet. These are simple things that you guys can do to take care of yourselves. Second thing is take care of others. Scout is helpful, is trustworthy, is obedient, is cheerful. So the direct way to take care of others is to reinforce good behavior in your family, like make sure they're washing their hands and following the rules. Educate others about the importance of this, right? I've seen a lot of stuff on social media and on the news saying that, this is all made up, it's a hoax, we're overreacting. We are not overreacting. In fact, we're probably a little bit late. And that's not meant to worry you. It's meant to explain to you why people are asking you to do the things that you're doing. Please buy in, right? Do your part to help this work, okay? Indirectly, we want you to prevent the spread of this because you could be a carrier. You just don't know. So follow the rules on social distancing and don't be bitter about this, right? Nobody created this, and yeah, it's a bummer, and you might have missed your spring break vacation, and some of you guys miss robotics or a band competition. I miss going to Italy to visit my daughter. Guess what? There'll be other trips in the future, and it's really important to do our part to make sure this is as controlled as it can be. So take care of yourself, take care of others. Next slide, please. This one's really important. Keep learning. So mentally awake, helpful, loyal, brave. Identify reliable sources of information that are science-based and data-based, right? The CDC is a great website. And then, but there might be others. It's probably not some, random end of the world fatalistic website somewhere, or something you heard from somebody's buddy or on some Reddit thread, right? Find good sources and consult them regularly. This thing is actually evolving. So you should adjust your behavior based on what the changing guidance is. And please don't spread rumors. And actually, some of the wonderful chat things that we had here tonight, could qualify as rumors. Whether or not this came from a bat in a wet market in China, that's interesting, but it doesn't really matter, right? It's here. It's affecting us all. So let's educate ourselves on what the things that we're supposed to be doing are, and let's do them, right? And eventually they'll figure this out, and they'll reverse engineer it, and they'll figure out exactly what happened. And I don't know, they'll go kill some bats maybe. Finally, if somebody does get ill at home, and it's before we've set up like drive-by testing centers and things, make sure you think about what you're going to do. So the CDC has a good website on what to do if you get sick. It's really identifying what the conditions are, and then what sort of actions you should take. And so, Dr. Sincilla, if you could actually just add a little information, a lot of detail to that, like what would you recommend people do if they start exhibiting, any sort of signs of an illness that could potentially be COVID-19? We have to unmute you. Hang on a second, Bob.
He's unmuted.
Okay.
All right, no, he's not. Hold on. Yeah, now he was.
All right. So
all right, we got you now.
First and foremost, if you're feeling ill, make sure you have the equipment that you need to have at home to actually document whether you're truly sick or not. So make sure you have a thermometer that works. Make sure, you talk to your parents about having the right medications at home in terms of something for a fever, runny nose, cough, and cold type symptoms. If you start to feel ill enough that you think that you might need to be evaluated by a medical professional, first and foremost is that you should probably place a telephone call to your family doctor, your primary care physician, whoever it is that you see for your, physical exams for school, or whoever you follow up with during the year when you do get an illness. If you can't reach those folks and you feel ill enough that you think you need to be evaluated, the emergency department is certainly a place that you can utilize. We're asking people to really try and follow a stepwise fashion where you reach out to your primary care physician first so you can get some guidance there, instead of having hundreds and hundreds of people coming over to the emergency department for something that could certainly have been managed outside of the hospital and or at home. So we would never tell anybody not to come in if they're sick and they think they have an emergency, but we're just trying to, again, balance things so that we're not overwhelming a system that's near, a tipping point as it is right now.
Thank you. Any other questions specifically on feeling ill or being ill? Just type them in, and we'll into the chat, and we'll try and grab those before we finish the section on COVID-19. Mr. George, next slide, please. Questions and breaks. So any other questions here? Mr. Elliott says many insurance companies are encouraging the use of telemed services. So some of your guys' parents might have the ability to just like this, right? To have a video chat with your doctor, and who will ask you questions about how you're feeling and what your temperature is. Actually, Doc, I read somewhere that sort of the magic temperature was it 100.4? Is that sort of when you start having some concern?
Yeah. So generally speaking, we consider a fever a temperature of 38 degrees Celsius or 100.4 Fahrenheit. Technically below that, you're not considered to be febrile. And really, we wouldn't consider testing you if you come in and you have a normal temperature.
Thank you. Here's another one. In your professional opinion, Doc, will this be dragged out over weeks, months, or longer? Will the state of canceling everything be a constant for a while, or will things die down before the end?
So it's a difficult question to answer, but again, it all comes down to how well we dampen down that curve. And if we, if I always tease patients when they ask me about what's going to happen with them tomorrow, and I tell them if I knew what was going to happen tomorrow, I wouldn't be here today because I'd have played the lottery yesterday. But I think that we're looking at a minimum of weeks, hopefully not months. But if we continue to do what we're doing around the country now with trying to, again, mitigate risk of transmission, let's see where we are once you guys all hopefully go back to school somewhere around March the 30th. And we'll have a better assessment then about how much longer things might need to be kind of shut down or tampered down until we see what's going on.
Okay. And then one more. So this is an interesting question. If you get the coronavirus and you recover from it, can you get it again?
No, there's no proof that once you're infected and you've recovered that you're going to become acutely reinfected. I think there's a lot of misinformation out there about that. So I wouldn't believe stories of people being tested positive, recovering, and then all of a sudden testing positive again. Once you've developed immunity to a virus, you have lifelong immunity to that, at least to that strain of the virus, and you shouldn't end up positive again.
Thank you. That's super, super helpful. All right. So, the final thing is, Mr. Elliott, you were going to talk about a couple of things that your company was doing because Mr. Elliott, guys, manages a whole lot of teams internationally. Much like Aviv, having to do certain things in Israel, like it's not just us. So I wanted to ask him to speak about that for a minute. Mr. George, I don't know if you can identify. Is he Steve? Yeah, there he is.
Yep.
Great. Thanks, Bob. Just real quick. It really is not just a U.S. issue. It's an international issue. We have call support centers in Panama, India, Jamaica, as well as a number of sites in the U.S. And we're working basically around the clock to move all these folks to work at home locations to help with the social distancing and to utilize the technology to try to pull this all together for a lot of different reasons. One is to create the distancing, but also to help keeping the economy running, because that's another important part of what's happening with this, to make sure it doesn't spin out of control. So all of our clients are taking it really seriously, and there is so much activity going on to try to meet with the demands what's going on here, but to keep the world running.
Thanks, Mr. Elliott. Yeah, and it's also good to sort of know that it's not just us. Sort of having to bear the pain. One more question for Dr. Sensilla. Do you think the virus will mutate? And if it will, what do you think will change in the virus?
In theory, any virus can mutate. That's why we see different strains of the flu over the course of the year. There are some conversations about two different strains of the coronavirus right now, an L type and an S type. And that one might be a little bit more virulent than another. And that's why we might see some of the increased death tolls that we're seeing around the world. But there's a lot of studying that has to go on with that. And I wouldn't concern yourself with mutations right now. Let's just get through this first acute phase.
Thank you. Okay, so I was going to take a break, but what I'm going to do right now is just sort of move into the merit badge, and that will probably end up we'll probably end up ending the meeting just a little bit early. So let's just roll into this, Mr. George. Dr. Sensilla, if you want to stay on, great. Appreciate having you, and we may actually put some of these as like an FAQ on the website and have you answer them periodically if you're not super tied up. And we hope that our actions and the actions of others don't make you super tied up, and we keep flattening the curve.
Nope, no worries.
Thank you. So, guys, this is Public Health Merit Badge. This is really cool, and I mentioned you guys in the I think in the email and on the website that we've actually done this once before. So Troop 98 went to Camp Okanagan in 2007, and in week 1, Camp Okanagan had a very sudden case of the norovirus, and the norovirus is not a respiratory virus. It's like a stomach bug. It spreads around very, very easily, and by I think the middle of the first week of Okanagan, they had ended up shutting the camp down and sending everybody home. because they had like, I don't know, 150 kids down in the infirmary, and they're like, we can't keep doing this. The numbers kept climbing every day. So they shut the camp down, and they scrubbed the whole camp, and they cleaned it all, and they reopened for week 2. And by day 2 of week 2, they had 150 kids in the infirmary again. So they were unsuccessful in solving the norovirus. So they shut camp for a full week and a half. They cleaned it all, and then we ended up going back in week 5, and we made a really cool shirt that said "No More Noro," and it had this yakking virus on the back. And everybody on Akanikan staff wanted one of our shirts. And we ran Public Health Merit Badge as an optional merit badge in our campsite that year. And we just think it's just a really cool badge. I think Mr. Stobie suggested this to me recently also, and I believe he said it was required, a required badge when he was a scout, although I don't remember that. But anyway, he's earned it before. So this is an old pamphlet from Public Health. I can't see the date on there, but it's like really old. And it actually has a cartoon at the bottom. Mr. George, advance to the next slide. This is really funny. So this is a bunch of scouts carrying flags that say common sense, sanitation, pure water, pure food, sunshine, and soap. And they're chasing away dirty food, general disorder and filth, flies and mosquitoes, neglected garbage, a microbe bomb, bad drainage. So it's just kind of cool that this has been around for a really, really long time. All right, so next slide, please. So these are the 2 requirements we're going to touch on tonight on the website, and obviously you can just Google it, and on the emails I sent you, you can see the rest of the requirements. This is not a very complicated badge. So tonight we're going to look at a Prezi that another scout leader developed that goes through most of requirement 1 and requirement 2. And what we're going to have you guys do is actually fill out the worksheet. So just so that we can document. So some of this stuff, so we're going to have you do 1B and 1C on the worksheet, and we're not like kind of going to give you those answers in the presentation tonight. But these are super easy things to do. You can just sort of Google them and learn about them and come up with some answers. So let's just go right into this. Mr. George, next slide, please. All right, so this is the Prezi. So let's not click on that yet. So I want you to complete 1B and 1C in the worksheet. And we have all the worksheets and the requirements on our advancement page from our website. So you can start on that worksheet whenever you want. You can either print it out and fill it out by hand, or if it downloads into a PDF and you can fill it in electronically, you can do that as well. And later on, we'll tell you how to turn it in once we're finishing up the badge. So if we're still meeting electronically and we get through this badge, we'll allow you to submit it to us, like somehow through an email or the website. If we start going back to meeting in person, we'll have you turn it in at a meeting. So, all right. So Mr. George, if you could click on this Prezi for us and bring us that window. All right. I think this has no sound. And it's kind of self-explanatory, but I'll just go along with what they're doing. Okay, Public Health Merit Badge. Thank you for your attention. Oh, was that the end? Did I give you the link to the end of it?
No, I clicked the wrong way.
Okay, thank you. You're feeling great? That's unusual. We'd better run some tests. And this is the dude that, I don't know where Lee's Summit is, but he's an Eagle Scout. You think that's really him, or did he lift that from something? I don't know. Let's keep going. So the first requirement says, what is public health? Gosh, it sort of sounds self-defining, but there's actually some words that make a difference here. Next slide. This is what the dictionary says. The art and science dealing with the protection and improvement of community health by by organized community effort and including preventive medicine and sanitary and social science. So I think the guy that put this together said, you know, personal fitness, and we have a merit badge on that, that's about you. But public health is about the health and wellness of the community. Next, please. So what does it involve? Preventing disease, which is everything we talked about tonight on coronavirus, avoiding injuries, promoting healthy lifestyles, and fostering community. Next, please. Requirement 1A, what is public health? Next. All right, this is kind of what it does. So funding public health protects our communities and kids, saves lives, and saves money. So keeping our kids healthy and community strong, saving lives, saving money. Next. Yeah, guys, we will send you the Prezi link because you'll be able to build your worksheet from this. So these are like different phases of community health. I'll start at the top right. Screening people for HIV or AIDS, or screening them for anything else really, but HIV and AIDS, probably when this thing was produced, 12 years ago, was a much more important issue. And they've actually gotten so much better at controlling that now. Providing health services in rural areas, because some places might have difficulty even having enough doctors. Promoting healthy lifestyles to reduce chronic conditions, keeping our air, water, and neighborhoods clean, promoting on-the-job health and safety, reducing tobacco use. We're going to see some pretty cool stats on that in a minute. Giving women cancer screenings, screening newborns for health problems, protecting people from disasters and disease outbreaks, and immunizing children, vaccination. Next slide, please. Public health saves lives. For each 10% increase in local public health spending, cancer deaths decrease by 6.9%, diabetes deaths decrease by 3.2%, cardiovascular deaths decrease 1.4%, infant deaths decrease 1.1%. So those are all decreases of things that you don't want, right? You're getting less of a bad thing by spending money on public health, by either educating people or vaccinating them or encouraging them to wear their seatbelt. Seatbelt use reduces serious injuries and death in car crashes by 50%. And this stat is fabulous. In the 20th century, the US reduced the rate of adults who smoke from 42% in 1965 to 25% in 97. Think about that. In 1965, almost half of everybody smoked. And now it's not even a fifth of people. So less than 20% of adults are smoking now. That's a huge, huge benefit to the overall health of everybody. Next slide, please. Public health saves money. For every dollar you spend on prevention, you save $5.60 in health spending later. So if people get sick, it's going to cost money to treat them when they're sick. If you can spend money preventing them from getting sick, it's just a better deal overall. Every dollar spent on childhood vaccines saves $16.50 in future healthcare costs. And 75% of US health spending is on preventable chronic conditions such as obesity, heart disease, and diabetes. So think about that. Of all the money we're spending on medicine and on healthcare, we're spending it on preventable things. Obesity, right? You can prevent that by keeping your weight down. Heart disease, you can prevent that by getting in good shape, right? Reducing your weight and being active and eating the right foods. And diabetes, same thing. But only 3 cents of every dollar, that's 3%, goes towards public health and prevention. So we're spending a lot of money after we have a problem, and we're not spending enough on preventing the problem. That's one of the core principles of public health. Next slide, please. An ounce of prevention is worth a pound of cure. We must protect and increase funding for public health programs at all levels. And I guess the American Public Health Association would like us to do that. Next slide. So this might be helpful for your definition if you're going to write this in the worksheet. Public health involves preventing disease, avoiding injuries, promoting healthy lifestyles, and fostering community. Next step. Next slide. Preventing disease, creating vaccines, and we talked about that tonight. Hopefully, we'll have a COVID-19 vaccine, and you guys are living through the whole process of how that's done. Promoting cleanliness, stopping germs and staying healthy, not just for COVID-19, but for some other stuff that we're going to talk about in a minute. And food safety, so making sure that the entire process of getting food from wherever it originates into your house and to your table is actually monitored, and people are doing the right things to keep it safe. And that's the FDA. It's called the Food and Drug Administration, who's responsible. That's the government agency responsible for doing that. Next slide, please. All right, avoiding injury. So the American with Disabilities Act is one of the things that makes requirements for making sure that there are ramps into buildings and handrails for people that have disabilities. And I know some of the guys in this meeting right now actually got Disabilities Awareness Merit Badge, but that helps them from getting hurt. Laws on seatbelt use have, I think, exist in almost all of the country now, and helmets. And you guys know, and this year we're actually doing a bike trip. If you're not going to Philmont, you'll be able to go on the bike trip. And we always take the time to check your helmets and check your bikes, and make sure you're wearing them the right way, because so many injuries on bicycles can be prevented, and really serious injuries, by having a helmet, having it be the right size helmet, and wearing it properly. Next slide, please. Go back one. Many entities exist to promote safety of individuals and groups. Can anybody name some entities that promote safety? See if anybody knows this stuff. I don't see any chats coming in. Mr. Clean? Yeah, I guess. The FDA is one of them, the Food and Drug Administration. Yeah. Good job, EJ or Ian. CDC, Center for Disease Control. Yep. They're right in the middle of the fire right now. Smokey the Bear. Yep. WHO. Yeah. The WHO is not WHO, but it's the World Health Organization. And they're in the middle of the whole coronavirus thing. OSHA is called the Occupational Safety and Health Hazards Administration. So they look mostly at hazards in the workplace. And they make sure that, ladders and things are, just all sorts of rules on working safely. NTSB is the National Transportation Safety Board. And they set speed limits, and they require airbags and seatbelts. They require even things like, how well your headlights can illuminate the road. The USDA is the United States Department of Agriculture, and they look at our food supply. The NRC, thank you, Sensillas, that's the Nuclear Regulatory Commission. So that actually promotes the safety of the nuclear industry, but that definitely helps us in the end, because if there's a nuclear problem, it's probably going to affect a lot of us. So thank you. Good job there. Next slide, please. Super hyper mega bonus round. What does natural gas smell like? And what should I do if I smell a gas leak? Let's give them a second to answer that, Tim. What does natural gas smell like? And what should I do if I smell a gas leak? It smells like gas. Rotten eggs. Nothing, but it has a smell put in. Nothing. Smells like garlic. You should call 911. All right, so I got some good answers here. Let's advance to the answer. These are all good answers. Natural gas smells like nothing. So all by itself, when it comes out of the ground, it doesn't smell at all. When they actually stick it into pipelines and send it to wherever it's going, including into your house, they add a scent. So it smells very similar to rotten eggs. They do that on purpose, right? It's a tracing scent because they want you to identify the smell so that if you smell it, you know to do something. So if you smell gas in your home, open the windows to let in fresh air. Don't stop to turn off anything that could start a fire. Get out. They should have said get out. They didn't say get out here. I wouldn't even stop to open the windows. I would just get out unless the window happens to be on the way. Call the fire department and the gas company from your cell phone or a neighbor's home to report the leak, right? It's very, very easy if there's sufficient gas in a home to spark that gas. You don't need a heck of a lot. I mean, it could even be you touching a doorknob from the static friction of like walking across a rug. Sean Couch says, open the window, then jump out of it. All right, now we're getting silly on chat. So, but you guys know this drill, right? Get out, and there's definitely situations where natural gas has had very devastating effects, and this is just something to know, very important for public health and in your house. Next slide, please. Promoting a healthy lifestyle. So we talked a little bit before about preventable diseases like heart disease and obesity and diabetes, right? So what can you do? You can be active. You can join a rec league. You can get involved in community centers. You can learn good information about a healthy diet, right? The My Plate and the My Pyramid is stuff about food choices. And you guys actually need to look at that when you're preparing meals and doing things for ranks in the food cooking portion of your ranks, and also for cooking merit badge. So a lot of this stuff really goes along with being prepared and scouting, and is part of physically strong. Next slide, please. Fostering community, public concerts, fairs, service, and social clubs. That gets you active, but it also provides an opportunity for you to learn and also to spread good information and educate people about things that they should do to keep themselves healthy and safe in the community. So that's why this is one of the definitions of public health. Next slide. Any questions? All right, I think we've done, most of that was requirement number 1, and it was mostly 1A. But I think we're gonna go in, let's go to the next slide, Mr. George. Just pull up my requirements on a separate screen. Okay, yep, thank you. Oops, let's go back in and let's talk about E. coli.
Next slide here.
No, I'm sorry, go back into the Prezi. Sorry, yeah, right there. Let's zoom that in, please. Okay, so in the merit badge, you need to talk about and define some specific diseases and health diseases and illnesses. And we're going to talk about those right here. So, wow, if you can pronounce this, you get the badge for free and no work. Enterohemorrhagic bacteria Escherichia coli. So that's called E. coli. E. coli is actually part of all of our digestive systems. And most of the strains of E. coli are harmless. You actually need them to have good digestion. But some of the strains of E. coli are a hazard to human health. So the source of most of these bad E. colis are cattle, and they're carrying that. And once you eat uncooked milk or improperly cooked meat and raw milk, or if fruits and vegetables aren't properly cleaned and they have come into contact with animal droppings or water that's run off from fields where animals are grazing, and it goes into the plants or near them, and then you get that inside your system, like 3 to 8 days later, you're going to get a serious illness, right? So you'll get stomach muscle spasms, aka cramps. You'll get diarrhea, sometimes bloody diarrhea, and you can get a fever and vomiting. And you can actually get complications from this, which is hemolytic uremic syndrome, which I'm sure Dr. Sincilla could tell us about, but it's just something you don't want to get, right? The good news here is that you're going to know, and you're going to know soon, and you'll be able to treat it. But the better thing to do is not get it. So how do we not get E. coli? So part of this badge is going to say, identify an illness or a disease like this, identify where it comes from, how you treat it, and how you can prevent it. So treatment, rest and drink fluids. I think they actually treat this with antibiotics. Is Doc still on? Maybe no.
It is.
Bob, I'm here.
Do we treat E. coli with antibiotics?
If you have this version of E. coli, yes, you would be treated with antibiotics. And what you're talking about with hemolytic uremic syndrome, you end up having renal or kidney failure, and you can end up on dialysis.
Oof. Not a good outcome. All right. Thank you, Doc. So treatment, rest and drink fluids, and I guess in a bad enough case, you're going to treat it with antibiotics. Next slide. Or next Prezi, sorry. Next Prezi slide. Thank you. Rusty nails. Why do we have rusty nails there? Bacterium, Clostridium tetani. I don't see anybody answering that. Should sound something like a vaccine you've had. Yep, tetanus. There you go. Luke spelled it right. Tetanus. And you can get it when rusty metal, so typically they talk about rusty nails or scraping yourself against, a metal fence. But that's typically how you're going to get this bacteria inside your body. There is a vaccine available. In fact, one of the things we require you guys in Scouts is to have had this. And I don't think I've ever had a Scout come through 98 that didn't have a tetanus vaccine. If you do get it, you'll get treated with an antitoxin and antibiotics. And I do believe that you need a tetanus booster from time to time. Yep, there it is, John. Every 5 years. I don't remember exactly when, but typically you're going to get a booster maybe in your teens and then when you're an adult. I think it was every 10 years. Yeah, there's Doc. Doc said every 10 years you're gonna be looking for a booster. So you guys will have the joys of getting vaccinations for the rest of your life. It's not just getting jabbed when you're a kid, but it's super important to stay protected against this stuff. Next Prezi slide, please. Symptoms and spread of HIV and AIDS. Human immunodeficiency virus is HIV, and that causes acquired immune deficiency system, AIDS. So there's a picture of the virus. I hope a lot of you guys have studied this. This can spread through unprotected sex, use of syringes and sharing needles, tattooing, if it's not done well, and skin piercing, even the use of other people's razors and toothbrushes that have a residue. Babies can be infected if their mothers are pregnant, and the baby can actually become infected. And then if the healthcare system isn't doing a good job and using sterile processes, they can actually pass HIV from one patient to another. That, I would say, is probably rare in the US, but in other countries that don't have as careful and as evolved a health system as we have, that's a problem. So there's lots of ways to protect yourself from this. And, we're not going to go into a whole sort of bio class here, but obviously if you're going to be engaging in sexual activity, protection is super, super important. And, hopefully we don't have any intravenous drug users inside Troop 98, but this is just a disease that's completely preventable if people behave appropriately. And it's just a great example of how being informed and taking the right actions can keep you and other people safe. So I don't believe there is any vaccine or cure for AIDS right now or HIV, but there are drug interventions that help lessen the symptoms and actually can lower your risk of getting it. But this is just not something you want to mess with. Next slide, please, Mr. George. Salmonella. So almost any kind of food or beverage can carry the bacteria that causes salmonella. Most people think about it as meat and eggs, and typically people say undercooked chicken. So if you ingest the salmonella bacteria, it goes to your small intestine, it sort of grabs onto the lining of your intestine, and they start living in there. In severe cases, they can get into your bloodstream, and it can be deadly. So look at this. This sounds familiar, right? It sounds a little bit like E. coli: nausea, vomiting, fever, diarrhea, and abdominal cramps. Most people recover without treatment, but in severe cases, it can actually mess you up. So you'll typically take antibiotics here. So the protection here is making sure things are washed before you eat them and then cooked properly, especially for salmonella, cooked through. Next one, please. Encephalitis. So rapid onset swelling of the brain can be bacterial or viral, avoided with standard sanitary practices. Treatment is symptomatic. Doc, are you on? And can you give us a little more detail? This one looked a little thin in the Prezi on encephalitis. And Mr. George, is he unmuted?
Yes.
Thank you. Thank you. Can you give us a little bit more background on encephalitis, where you get it, and
Yeah, so encephalitis is a very generalized term for non-specific inflammation of the brain. And as you described, it can come from both viral and or bacterial means. It's more often associated with viral illness. And many of you will know what West Nile virus is. And people can get bitten by a mosquito that transmits infections. And if you end up, unfortunately enough, with something like with West Nile disease, you can get non-specific inflammation of the brain, and that's West Nile encephalitis. There are other viral encephalitides that you can get. Herpes encephalitis occurs. You can get encephalitis from chickenpox in rare cases. So there's all kinds of variants of encephalitis. That's the sort of general term for inflammation of the brain. Meningitis, which goes along a little bit with encephalitis, is inflammation of the meninges, which is the connective tissue that lies on top of the spinal cord itself. So you have different meninges that are there that can become inflamed.
Thanks, Doc. And so look, on this one, they're saying standard sanitary practices, which is making sure you're in a clean environment. The food, anything you're putting inside of your body is clean and sanitary and cooked through. When we go places, a lot of you guys have heard about Lyme disease, right? So we want to try and avoid insect bites, and we'll talk about that when we get to vectors, which is the way disease is spread. So that's how you protect against this. I'm watching the time because we're going to end at 9. Let's just try and get through a few more slides. Emphysema, primarily caused by smoking tobacco, toxin-based, irreversible without a lung transplant. So there you go. Great reason to never start smoking or quit if you've already started. Next slide. Botulism poisoning. We don't see this a lot, but low acid foods that were improperly canned. So if anything looks sketchy inside, like when you open a can or a jar, or if you know that it has been opened or cracked open, and anything smells kind of funky, just get rid of it, right? Examine all canned foods before you cook them. Cook and reheat foods thoroughly, and then keep cooked foods hot, or keep them cold. So a lot of times you'll see, many of you guys have maybe even seen Mr. Bryant with this. When he's cooking, he keeps a thermometer in his pocket. So if you're going to have food sitting on the stove, you need to keep it hot enough or get it in the fridge so it doesn't sit out and can start breeding nastiness. So this toxin is treatable with an antitoxin. Duh. All right, next slide. All right, so one of the things that the merit badge is going to ask you to do is talk about vectors. And a vector is the way that a disease gets transmitted from a source to a person that is contagious. So here's an example of a mosquito that basically lands on a bird and gives the bird a mosquito bite. The bird passes the disease to the mosquito, and then the mosquito lands on a human or a horse and transmits it to them. So a vector is like a carrier, right? The mosquito never gets the disease itself, but it transmits it, and it transports it, and it transmits it to something else, almost like a bee pollinating a flower, right? It's just carrying that that thing from one to the other, but in this case, it's an undesirable thing. Next slide. Here we have ticks. So what are we talking about here, right? So this is, and you've all heard about Lyme disease. Thank you, Tucker. So Lyme disease was actually discovered in a little town called Lyme, Connecticut. It's Lyme. And the scout troop I used to be with previously was one town over. So we were at the epicenter of Lyme disease when it was first discovered. It can have really, really bad effects. So one of the things we try and do is stay out of high grassy areas. And whenever we come back from camp, we ask you guys to check for ticks and then remove them promptly. The good news is if you get the tick out of there quickly, it doesn't have long enough to basically implant the disease in you. So the vector is unsuccessful, but we really, really need to be careful with Lyme disease in scouting because we're in the outdoors a lot. Next slide. Okay, so it's 8:56. I'm going to hold off requirement 2 until our next meeting because it's going to talk about immunization and vaccines, why it works, the history behind them, and some examples of really good ones, and which ones that you typically get, and which diseases for which vaccines don't yet exist, and sort of the cycle of when you need to take them. So we'll hold that off. So Mr. George, if you could go back to the, thank you, to the main presentation, and we'll just kind of wrap up for tonight. So let me go into the Scoutmaster Minute. So I want to remind you what we talked about earlier in the presentation, right? Take care of yourself by following the rules, staying healthy, and doing whatever you're supposed to be doing to stay healthy. Take care of other people by reinforcing the good behavior in your family, preventing the spread. And I know it stinks to be locked in your house and not be able to go to school or band or your sports teams or anything else fun that you were doing. But this is worth it, and it's important that you do it seriously. Next slide. Keep learning. So spend time keeping yourself informed. Find those reliable sources of information. You know, pay attention to the news. I would tell you don't get so focused on the news because you could watch, you know, news channels all day about this, but stay on top of what's going on. Keep yourself informed. It is going to change. Thank you, Tucker. Facts. Don't spread rumors. And then be prepared. If somebody gets sick, think about what you're going to do and just have a little bit of a plan. Like Dr. Sensilla said, make sure you have medicines, make sure you have a thermometer. Listen, sometimes your parents are really, really busy and they're figuring out what to do. And maybe they're not able to go to work and they have to figure out who's going to take care of you. Help them, right? You can figure out some of this stuff yourself. Do it politely and pleasantly. But say, hey, I think we should get this, this, and this, or let's make sure we put new batteries in the thermometer scanner, or get, you know, a regular one that you shake so that it's ready, and have it all in a place where it's available and you can use it. That's part of being prepared. Next slide. So this is a cool story about Apollo 13, and there's a quote here that the superintendent of Wissahickon sent around to everybody today. So I'm going to read this. And if you saw the Apollo 13 movie, this was a really key moment in the movie with Tom Hanks stuck up in the lunar module and the people on the ground trying to get them home. So when the Apollo 13 oxygen tank failed and the lunar module was in danger of not returning to Earth, Gene Kranz, the lead flight director, overheard people saying that this could be the worst disaster NASA had ever experienced, to which he is rumored to have responded, "With all due respect, I believe this is going to be our finest hour." And as you know, against all odds, they did everything they needed to do, and they got those 3 astronauts home. It was incredible. And it wasn't a miracle. It was hard work, perseverance, and everybody chipping in together to do things right. So imagine if we could make our response to the coronavirus crisis our finest hour. Imagine if a year or 2 from now, we look back on this and told stories of how we came together as a team in our community, in our state, in our nation, and across the world. Your contribution to the finest hour may seem small, invisible, inconsequential. You know, hey, I'm just staying home, right? But every one of these small acts of not doing what you were going to do and doing an act of kindness or support is going to add up exponentially. That's what I'm asking you to think about. and do. Next slide. And with that, I think Luke Murray, Mr. George, could you unmute Luke? Because I think we lost Zach Malloy.
All right.
Luke, I'd like you to lead the troop, please, in the scout oath.
On my honor, I will do my best, do my duty to guard my country, and obey the scout law, to help
my
other
country,
people at all
the
times,
scout law,
myself
help
physically
other people at all times,
strong, awake, and morally straight.
self-strong, and morally straight. Thank you, Luke. Next slide, please. All right, so guys, thank you for participating tonight. This was really cool. We now have proved that we have the ability to meet and pass around important information, to work on a merit badge, to have a fun chat, to say hi to our former scouts in Israel. And I wish you guys the best. I want you also to please, if you have any problems individually within your family that you need help with, please send me a message. There's a lot of people in Troop 98. We have a lot of resources and contacts available, and we'd love to help you in any way we can. And as of now, next week's meeting will also be online. It's almost certain that we will not go camping next weekend. Depending on what the situation is, we may actually go on a day hike on Saturday if we think that that's not violating the stay isolated rules. So we'll find out information on that and let you guys know. So thanks very much. Stay safe, be prepared, and be smart. And thank you very much, Dr. Sensilla and Mr. George, for helping set up all the technology on this. And good night.
Thank you, everybody.